Root causes. I want to talk about root causes and why you feel the way you feel. Root causes is probably one of the most overmarketed, overused terms in medicine ever known. And unfortunately, most of the people I see on YouTube and social media and other doctors and colleagues and things are really missing the root causes. So the whole definition of root causes is suggesting to go all the way back to the beginning. Where did this thing start and where am I now? But where did this thing start? And a lot of my colleagues and functional medicine practitioners are actually talking about intermediate root causes, meaning not the actual root cause. It may be a cause, but there's a cause to that cause and a cause to that cause, and ultimately the root cause. So I created this diagram several years ago, and it's been a diagram that's been kind of being made in my head over time. And I decided it's finally time to start putting it on YouTube so you guys can see what it is that I believe. This is a totally unfiltered, biased version of root causes and how I see it in functional medicine. Now, I'm biased, this is my opinion, but I really believe that everyone should be operating under the same diagram that I am. Not to say this is the only way to skin a cat, but as far as I'm concerned, it is the best way to skin the cat. I've been practicing functional medicine and seeing patients for years, and this is what I've learned is the tried and true mechanism of root causes and healing patients in order to get them better the fastest. Now, this is an oversimplified diagram, my root causes diagram, but the idea is it should fit almost every clinical scenario that comes to mind, whatever patient shows up into my practice. It should be able to be customized for that person to help them understand why you feel the way you feel. So I'm a very visual person, and I assume everyone else is, so let's dive directly into the diagram to see why you feel the way you feel. So if we look at this diagram, really where everyone is mostly focused, doctors and conventional medicine and patients are focused on symptoms. The symptoms is not the root cause. That's the way you feel. That's not why you feel the way you feel. So let's put some examples on here to start making sense of everything and say, here's symptoms down here. We're going to zoom in and just get rid of everything else on the screen. What symptoms might you be experiencing? Anything. It could be fatigue. It could be weight gain. It could be, I write terrible when I write fast, weight gain. It could be brain fog, it could be rashes, it could be joint pain, it could be whatever symptom. The symptom that you feel is not a cause, it's just what you feel. In fact, cancer even goes on this diagram. Cancer is a symptom, it's not a cause. It may feel like the problem that you're dealing with right now because it's such a big one, but that's a symptom of something else going wrong in the system. So once you see your symptoms, unfortunately, this is where conventional medicine kind of gets stuck. They say, we'll use reflux, for example. So say you've got reflux, and they'll say, oh, your heartburn, your reflux is caused by too much acid. That's what they say. That's not what we say, but they'll say too much acid. So here, if you take this acid blocker, this PPI, this omeprazole, Prilosec, Nexium, whatever they give you, they're going to treat that symptom. They never ever zoom out and see what might be causing that acid. They just give you that medication and say, there you go, see you later, keep taking this the rest of your life. That's not what we do in functional medicine. We say if you acquired something along the way, if you developed a symptom, that generally means you can unacquire it. Now, I always have to add a little asterisk here. If you get your leg bitten off by a shark, we're not going to be able to grow another leg back, okay? So let's keep this in realm of functional medicine, chronic disease type things. If you acquired something, generally speaking, you can unacquire it. Cancer is a big question mark because that's very difficult to reverse because you're up against the clock and your own human tissue. So I use that in the symptom idea, but let's scratch that out from this diagram today. Mainly, we're focused on all the chronic symptoms, joint pain, fatigue, rash, all the concept, bloating, gut issues, all that jazz. Those are all symptoms. So if you take that symptoms and you start to zoom out, you start to see things come into the diagram. You can see things like inflammation, which if you're in the current century paying attention at all, you've definitely heard the word inflammation. All inflammation is saying is the immune system gone rogue, meaning the immune system's attacking the body in some way. It's not necessarily the same thing as autoimmunity, although you can see those two are closely linked together. Inflammation causes autoimmunity. Inflammation is more the idea that something that continues attacking will eventually become damaged. So use dental disease, for example. If you have inflammation of your gum tissue, gingivitis, that inflammation is supposed to be fixing the problem. You've got a bacterial overgrowth, and the inflammation, your immune system's trying to attack it to fix it. But if it never fixes it, that's called chronic inflammation. Chronic inflammation will eventually damage the gums, and they'll start receding and doing all that. But then also the chronic inflammation starts to spread to the heart and other parts of the body, causing disease elsewhere. So chronic inflammation anywhere happens to cause disease anywhere. And they've proven that. And I use dental as an example because they've proven that multiple times. Chronic dental inflammation causes heart disease and strokes and all kinds of stuff. But inflammation causes symptoms by itself. So there's the inflammation arrow connecting to the symptoms. So say your joint is inflamed. Well, of course, that's going to cause joint pain. That's obvious. Say your brain is inflamed. Well, that's going to cause brain fog. Whatever is inflamed will cause issues, basically. If your muscle's inflamed, it's going to hurt. So commonly inflammation is pain, but many times in certain places, inflammation does not cause pain. So say you got fatty liver in your liver, that's inflammation. You're probably not going to feel that. Your doctor may see it on labs or may see it on ultrasound, but you're not going to feel that inflammation. So inflammation does not always mean pain. Inflammation, when it gets more specific, where the immune system is attacking itself, that's what we call autoimmunity. So to use joint pain for an example, so if you have erosion of the joint, that's called osteoarthritis. If you have arthritis in there, that's going to cause inflammation, that's going to cause pain. If you have your immune system attacking that joint, so say you have rheumatoid arthritis, my diagram is up. Say you have rheumatoid arthritis, RA, then that means the immune system is actually attacking the joint and destroying the joint. Well, that also is joint pain, but a little different inflammation version. That's more direct immune involvement. Autoimmunity just means, auto means self, immunity means immune system. So self-attacking immune system, and that's what's causing your symptoms. So here we go. We're going through the diagram of some of the causes. Now, you might notice there's some arrows up above. Those are the root causes. We haven't even touched that. We're just in these middle tier causes right now. So I call all these in the middle here kind of the middle tier causes, and this is where a lot of functional medicine practitioners and integrative practitioners, that's where they get stuck. So we're going over that right now, but we're eventually going to get into the root causes. The next section is hormone imbalance. So hormone imbalance is a big deal. Of course, everyone knows it. When your testosterone's low for men, you feel lethargic and just not vital, and your sex drive's low and you're just not vital, basically. If your adrenal glands are producing too much cortisol, your stress hormone, well, that's going to make you tired, and you're not going to sleep well, and you're going to have brain fog, hormone imbalance. Thyroid dysfunction, of course, if your thyroid's slow, you're going to feel slow, you're going to gain weight, you're not going to grow hair, all of those things. So hormone imbalance is a pretty easy one to understand. That causes direct symptoms. Menopause, for example, you might have been fine in your fertile years, but when you went through menopause, you started developing hot flashes and night sweats. That's directly related to symptoms from a hormone imbalance. The last one is certainly not the least one, this mitochondrial dysfunction. I went back and forth about including this in the diagram as far as that wording, mitochondrial dysfunction, and I left it there because I don't like to use, as a doctor, I don't like to use big words to confuse patients or make myself look smart. I do like to look smart. But the reason I put mitochondrial dysfunction on there is because it's a really all-encompassing term, phrase. And if you don't know what the mitochondria are, I've never heard of it, you need to go do a deep dive and learn all about the mitochondria because it is frequently the problem in many human diseases. So the mitochondria, put simply, are the thing that make energy for your cell. Now, that's easy to say, but let's rewind that and unpack that a second. The mitochondria makes the energy for the cell. You have billions of cells in your body, and each cell has to make its own energy, no different than there's probably billions of cars on the road, and they all go to gas stations, unless they're an EV, that doesn't work. But if they go to the gas station and they put gas in their tank, the engine of that car has to manufacture energy in order to get that car to move. You can have a gas tank full, but if the engine doesn't work, the car's not going anywhere. No different than you, human being. You can eat all the energy you want, and bread and carbs and proteins and meats and vegetables, even a healthy diet. You can eat all of the energy you want, but your individual cells have to turn that energy into useful cellular energy. That's not an easy process. So this mitochondria can get dysfunctional. How does a mitochondria get dysfunctional? Well, through damage, through aging. Over time, it can lose nutrients. So if you don't have enough zinc, or you don't have enough magnesium, or manganese, or selenium, or molybdenum, whatever it may be, vitamins, nutrients, methylation you've probably heard of, detoxification, this organelle, this mitochondria, has to make energy. Not only does it have to make energy, it's got to deal with its own biochemical waste. Everything that makes energy makes byproducts. So it's got to deal with this as metabolic waste. If it can't process the metabolic waste, meaning it can't detox very well, well then the mitochondria is going to slow down and not make enough energy because it knows that it doesn't want to kill itself. So it only makes as much energy as it can deal with the metabolic waste, or guess what? It slows down. What happens if a tissue slows down its energy production? Well, let's think about that. If it's the brain and it slows down its energy production, guess what? We call that brain fog, or we call that poor memory, or we call that inability to focus, or we call it depression, anxiety, whatever it may be. Your brain's not going to put on a check engine light and say, hey, my mitochondria aren't working. You're going to feel a symptom. And that symptom, like I said, may be depression or brain fog or something going wrong in the brain, fatigue, chronic fatigue, whatever it may be. If a tissue cannot make energy, it will be dysfunctional. So say your heart can't make energy. Well, now you're fatigued because you can't pump blood around the system. Your liver can't make energy. Well, it's not going to detox as well. It's going to store more toxins. Your gut can't make energy. Well, it's not going to digest your food, and you're going to poop out your nutrition. So obviously, making energy around the body is extremely important. All of these things are very important. And what a lot of my functional medicine colleagues, sorry to disparage you guys, but a lot of my colleagues out there just want to give you vitamins and supplements to fix these middle tier problems. The problem, that's great and all, and we do lots of this too. We restore lots of hormones and give vitamins and nutrients. That's all great. But the problem is, if you never look any further above this diagram, then you're stuck on those vitamins and nutrients forever because you're not fixing the problem. You're just covering the problem by treating the middle tier. So yes, use the vitamins and nutrients, replace zinc and fix methylation and restore energy production. Do all that as much as you can, but ultimately you still have to make room in your supplement purse and your finances, energy, and ability to take all of these things. You still have to make room in your budget, life budget, for the root causes. So my message to my fellow practitioners is, don't get lost in the middle kingdom stuff. You have to make sure you go up to the root causes. If you fix the root causes, then as the human continues to eat nutritious food and live a good lifestyle, their own human body will fix the rest. So don't focus too much on this middle tier stuff. So don't get stuck in inflammation, hormone imbalance, mitochondria. Look further up. Now, I think I've talked about this long enough. It's time to zoom out further and bring in the final root causes. And it may not be as detailed as you thought it would be. It's actually pretty simple. I count 1, 2, 3, 4, 5, 6 root causes. It's that simple, that straightforward. Now, of course, the human body is not that simple. It's not that straightforward, but this is the root causes that I live and breathe by. Our practice lives and breathes by, because if you fix these root causes, then almost all human disease and suffering reverses itself. Pause, asterisk, remember, we're talking chronic disease that are required. We're not talking about if you get your leg chopped off or if your heart explodes, whatever it may be. Okay, so let's be reasonable. Let's keep the hatred to the side. These are things that are reversible. But one of the things I have learned, I was a conventional trained doctor, went to regular medical school. I was taught that many things are irreversible, like lupus. You're going to live the rest of your life with it. Wrong. We've seen lupus reversed. We've seen incredible things reversed. We've seen dementia reversed. We've seen arthritis reversed. We've seen incredible things reversed. So yes, you won't grow another leg, but in functional medicine, never give up. Keep looking. If you acquired something, then you can unacquire it. If you were born with a genetic dysfunction that you will never be able to do something, then functional medicine is probably not going to fix that, but it can at least make it better. Okay, so with my asterisks done, let's dive into the root causes. I'm going to zoom in a little bit. So these are the root causes. Now, you will notice that each of these root causes has an arrow pointing to the generic bar above inflammation, hormones, mitochondria. And that is because you cannot say one root cause causes one problem, causes the next problem. In every human, it's going to be a little different. You feed enough Americans McDonald's and cheeseburgers, and guess what? Some are going to have heart attacks, some are going to get dementia, some are going to get cancer. Everyone's way of processing their dysfunction is different, but the root causes of all human disease are this simple. Now notice they all have the same color arrow except for gut issues. Gut issues gets the red arrow. Now, if you've seen any of my YouTube videos, talk to me, seen me in person, you will know we make a big deal of the gut. And I could talk for hours on that, as you already know. But and I'm not going to skip this. The main thing I want to tell you is 3 simple things of why the gut is more important than everything else. Number 1, the gut is your portal into your nutrition. What do I mean by that? I mean, you can eat the best diet in the world, but if you don't absorb the best diet in the world, you just made a great poop. And great poop's great, but you need the nutrition, not just a great poop. Number 2, The gut is the house for your microbiome. And if you haven't done any research on the microbiome, then watch some of my videos. Go out there, look up the microbiome. What is the microbiome? The microbiome is your single greatest superhero that will help you get your nutrition and fix your immune system and detox the body. And it is the greatest thing you can have, or is your greatest supervillain. Over time, with antibiotics and processed food and stress and all the things, we end up developing this supervillain that's not only not helping us, it's literally hurting us, it's inflaming us, it's causing toxic overload, all these things, and we're not absorbing our nutrients. So once again, number one, portal into your nutrition. Number two, houses your microbiome. Number three, it's where the trash comes out. If you can't take the trash out, it's going to stay inside, and that's just a fact. Now, sure, you might be pooping every day, but there's a lot that goes in between just pooping every day and actually taking the trash out. So I can't go into it in this video, but basically the gut is the single most important thing you can do to heal yourself, because as you fix your gut, your human body wants to fix the rest. Now, the rest of this diagram is pretty straightforward. It's toxic overload. That's the simple way to say it, is toxic overload. Now, toxic overload is a very complex topic and involves multiple things. So let's go through them. The main five you see, four up here you see, are external toxins that you can measure. So we can measure biological toxins and mold toxins, chemicals, and heavy metals. The last one I'll spend a second on is emotional toxins. We like to call emotional toxins in our practice instead of stress. Stress is this vague, ambivalent, and confusing thing that, 10 people can have different stressors and feel different. Or I should say, 10 people can have the same stressor and have completely different outcomes from those stressors. But when you call them emotional toxins, it adds a little more validity to the stress, because stress is bad for you. Everybody knows that. But how do we quantify it? How do we give it a number, basically? And so we never want to give something power over us. That's not why we're going to call it emotional toxins. But we are going to call it emotional toxins so that we acknowledge how powerful it is and we appropriately deal with that. What I mean is, you can fix your gut and you can detox your body, but if you're living in a terrible social environment, you're living with an abusive person or family member or whatnot, you're not going to feel better no matter what you do. Emotional toxins are extreme. They are kind of the trump card. They will overplay almost all toxins in health. So don't discount that. But at the same time, make sure you give enough power to realize that you've got to modify those emotional toxins or you'll never get better. No Different said that if you drank a cup of gasoline every day, you'd probably be pretty sick, right? Should I give you supplements to try to detoxify that cup of gasoline? Should I give you prescriptions to try to eliminate that gasoline from your body? Or would you do better by not drinking the gasoline? That's how emotional toxins are. You can try to take 5-HTP and supplements and things to help deal with the stressors and the adrenal dysfunction, all the things that are happening to the body. But if you don't address the source, you will never get better. You cannot out-supplement a bad lifestyle. So emotional toxins are real. They affect this whole diagram. They multiply everything. If you have inflammation and stress, you have more inflammation. If you have mitochondrial dysfunction and stress, you have more mitochondrial dysfunction. So they are a root cause and need to be addressed. They're just addressed very differently with therapy and with lifestyle and gratification. And yes, supplements can help. Anyway, we're going to go into the other physical root causes of the toxic overload. So I'll address each of these topics because I go over them all the time, but you may not understand what I mean by biological toxins. Let's talk about biological toxins. Biological toxins is a vague way to explain anything that's living, growing, that's making toxins to make you feel the way you feel. Well, what do I mean by that? Well, let's say you have a sinus infection. That's bacteria overgrowing, fighting your immune system, causing inflammation, but they're also releasing biological toxins, biological warfare to irritate your system. They're trying to grow. They're trying to kill you so that they can continue to grow and multiply. They don't realize that they need us to survive, but that's a whole different story. So those biological toxins we absorb, we're sponges. We absorb nutrients and things out of our diet. We absorb nutrients and drugs out of our nose, which is why it's a delivery mechanism for drugs. So you're going to absorb toxins from that biological organism. So sinus infection, lung infection, gut infection, wherever it may be, and I shouldn't even just use the infection word, overgrowth. And overgrowth in an organism in the bowels is going to release biological toxins. They're trying to survive. They've even proven that good organisms in your microbiome, in your bowels, they can overgrow. And when they overgrow, they actually start to release a biological toxin to cause problems in the system. So it's not so straightforward as good guys and bad guys. It's the balance that matters. So biological toxins can also be Lyme disease. It can be any living organism inside you. And I'll even extrapolate it to say like things like EBV, Epstein-Barr, the chronic viruses that can live inside us. They can release toxins, no different than the herpes virus releases a toxin that causes the cold sore and those kinds of things. So biological toxins, anything living, growing that makes a toxin. Okay. Next are mold toxins. Mold toxins are a biological toxin. They get their own category though. Why do they get their own category? Because they're extremely difficult to detoxify by the body. I've done videos and stuff on that. We won't go into full detail. But remember, this is not the mold spore. This is not the living, growing mold. This is the gas. This is the chemical. This is the toxin coming from the mold. And it can go all over your body, into your brain, into your liver, muscles, everywhere. It's a toxin. Now, it gets its own category because the mold needs to be removed from the walls and from the where you're breathing it, but the toxins are stuck inside you and they need to be detoxified. So mold toxins gets its own category because they're really tricky and very powerful. They're probably the worst biological toxin out there. Next is environmental chemicals, which we've all heard of. We've all heard of glyphosate, Roundup, all the chemicals and plastics and things in our bodies and our environment and our food and our water. So environmental chemicals is basically our category for saying anything that's man-made, that's not necessarily biological, wasn't created by God and bacteria and fungus, not created by mold. It's the man-made stuff. Now, man-made chemicals is a little different than heavy metals. So heavy metals are naturally occurring. They're all over the world. Man has mined them from the depths of the earth and processed them and put them in our food and drink and things. So heavy metals are not man-made, but they are man's creation that has exposed us. And so environmental chemicals and heavy metals can often be confused by people. The treatment of those are completely different. Now, what I will do is I'll do another video on root causes, but the next step of this diagram that I go do for all of my patients that come to see me is we go over the root causes diagram as to why you feel the way you feel. Then we go to the treatment timeline, the next diagram, which I'll do another video on, that says, okay, that's why I feel the way I feel. That's great and all, that I understand that, but now what do I do about it? How do I fix those things? And so this will get important in the treatment timeline part because environmental chemicals are detoxified through a process called lipid exchange. Actually, all three of these categories are detoxified through your human process called lipid exchange. Heavy metals sound like a toxin and they should be detoxified, but that process is called chelation, a completely separate process that's not too native to humans. We don't really do that process very well. Lipid exchange we do on our own. Heavy metal chelation, not so much, and I've got videos on that also. So this is the explanation for root causes, why I feel the way I feel. I went into big detail over it, and hopefully that's starting to make some sense. And I would encourage you, no matter what doctor, practitioner, whoever you may be seeing, you need to ask them what they're treating, and you need to be able to put it on this diagram and say, okay, well, that's nice, and that's helping me feel better, but what am I doing to fix the root causes? And just taking some simple probiotics and some simple milk thistle is not going to reverse your root causes. It's going to take a lot more than that. So in our practice, we like to say that yes, you'll be on some supportive supplements that you'll just be on for life, fish oils, vitamin Ds, those kind of things. But the root causes we will be treating, and the idea is when we treat those root causes, we are fixing them. When they are fixed, you're going to completely come off of those supplements and hopefully never take them again, because that means the problem's fixed. And if it's not fixed, then we're going to get back on similar type supplements to fix the problem, and we're going to keep fixing that problem until it's actually fixed, and then you don't need that supplement forever. One of my pet peeves with functional medicine practitioners, and sorry if I'm disparaging people out there, but you should not be on a supplement nutrient forever. You should be able to get those nutrients and supplements out of your diet. Now, there's another asterisk there. There's a few supplements that we should all be taking. I'm a big fan of vitamin D, B complex, a probiotic, and fish oil. Those are kind of my basics that anyone and everyone should be on kind of long term. But the idea is you should not need to be on treatment type things for long term. There's some beneficial things that you can be on, like curcumin is great for anti-cancer and detox and all those. So if you want to be on a regimen long term, that's great. Some of that should be your choice, not I need this for life support. if you fix your root causes, you shouldn't need anything for life support. You should feel good all the time. Those other supplements are just accessory to feel better, not necessarily to feel better, to live longer, basically, because you feel like you're fixing a genetic problem, a metabolic uniqueness to you that it needs to fix, and you just can't live without it, and that's okay. You feel better on that support. But in general, if you fix these root causes, then you don't need that. So I wanted to take this a step further and give you some ideas of what you may be struggling with and a clinical case, so to speak, of how to work this diagram and how to use it. So say, for example, that you are a mold patient. So here we'll circle mold toxins. And if you're a mold patient, you almost always have insomnia. You're always going to have some sort of hormone imbalance. Why did I tie hormone imbalance to insomnia? It's because it messes with your adrenal glands. So as you mess with the adrenal glands, you can't sleep very well. And as you can't sleep very well, you now have insomnia. So the symptom is insomnia. And that's from mold messing with your hormones. And remember, where I used adrenals and stuff, there's hormones all over the body. Insulin's a hormone, there's brain hormones, there's neurotransmitters all over the body. So mold can mess with all of those. And we do a lot with mold, which is why I'm using that example. So the mold toxins are building up, causing hormone imbalance, causing poor sleep. Well, guess what? Mold also loves to affect your mitochondria, inhibit your mitochondria from making energy. Well, now your mitochondria can't make energy. So what's the symptom you feel there? Oh, you feel fatigue. Mold also loves to get into the brain. It just loves to inflame the brain, irritate the brain. So there we go. We're drawing an arrow to the inflammation. Oh, we've got inflammation. And commonly that inflammation triggers brain autoimmunity, brain inflammation. And so that you're not going to feel brain inflammation. What you're going to feel, though, is you're going to feel brain fog. Oh, my memory doesn't work. I can't focus. I can't do my job. I used to spout out these big words and now I can barely finish a sentence. Those kind of things. That's how mold would affect you. Now, it doesn't just stop there. That's the main top-down approach. But remember, this diagram isn't necessarily a one-size-fits-all. Now the mold is going to slow down the liver so you can't detoxify as well. So the environmental chemicals you're exposed to on a daily basis, the plastics and the chemicals and gasolines in your body, they're not going to clear as well. So now you're going to start storing more of those. Same with heavy metals. You're going to store more of those. Yes, 10 people may be exposed to the same heavy metals, but you accumulated more than the other 9. Why is that? Because your body wasn't as healthy. And so this is a snowball downhill that as you get sick, you get sicker and sicker until your body starts sounding all the alarms and you're going to conventional medicine. They're shrugging you off, just saying, here, take this Prozac and you'll feel better in the morning. In addition, and I saved this for last, of course, mold is going to cause all kinds of gut issues. As you get gut issues, you're going to feel worse. Your microbiome is going to turn into a supervillain. You're not going to absorb your nutrients. You're not going to take the trash out, and you're just going to get sicker and sicker and sicker. So that's one example of how this root causes diagram plays out in a real life world. Let's clean it up, and let's give another example. I'm going to use Lyme as an example because I catch some flack for Lyme. I specifically don't treat a lot of Lyme in my practice, but we do treat Lyme in my practice. What I mean by that is I'm not a believer that Lyme disease is the root cause of all issues. I'm a believer that your dysfunctional immune system has allowed Lyme disease to go crazy and affect your system. And now you feel the effects of Lyme disease, but you don't need to treat the Lyme disease. You need to treat the root causes. By fixing the root causes, you will fix your immune system, which will fix the Lyme. But Lyme does fit in this diagram. And I'm going to use that as an example. Not that Lyme is my favorite, but here's where Lyme belongs. Lyme is a biological toxin. It is a biological organism that's living inside you, releasing biological toxins, causing localized inflammation. So there's the biological toxin causing inflammation. The inflammation, say it's in the brain, because Lyme loves the brain, say it's in the joints, it loves the joints, liver, wherever it may be, will be causing the symptoms that coincide with that Lyme in the brain. It also loves to affect the microbiome, affect your immune system. As you affect your immune system, your gut starts breaking down. As your gut starts breaking down, everything goes dysfunctional. So how do we treat Lyme? Not by treating Lyme. You treat it the same way. You fix the gut. By fixing the gut, you restore the immune system. As you fix the gut, you restore the detox pathways. As you detoxify the body from all the other chemicals, metals, and biological toxins, the immune system gets better and starts attacking the Lyme for you. I've treated numerous patients and not had to treat any Lyme because as we treat the human, they treat the Lyme themselves. Trying to eradicate Lyme is actually nearly impossible. There's no good antibiotic supplement to really eradicate the Lyme. It's a whole system treatment. let's go a little more conventional medicine and let's do atherosclerosis. So atherosclerosis is the fancy word. You would know it more as artery disease, and you may not know it as artery disease. You would know it as heart attack. Heart attack, still the number one killer of Americans. Heart attack and stroke are the number one killer of Americans. Cancer is number two, and it gets a lot of attention. It's scary, but heart disease is still the number one killer of Americans. So this is important because that means, statistically speaking, I'm talking to you. Your risk of dying is heart attacks, not cancer. So how does heart attacks fit on this diagram? So heart attack is a symptom of a cause going on elsewhere. Well, where's that cause? They've proven it. It's inflammation. Inflammation of the arterial wall starts to attract cholesterol, starts to attract plaque buildup. As that plaque builds up, it runs the risk of rupturing. When it ruptures, you're now having a heart attack. But this is chronic inflammation gone awry. Why are you inflamed? Well, it's going to be one of these causes up above. Primarily, our heart attack patients, our atherosclerosis patients, usually have lots of gut issues, lots of inflammation, malabsorption, nutrition issues. In addition, they've commonly got lots of heavy metals. Now, I'm not saying for sure for every person. I'm just saying, statistically speaking, it's common for a heart disease patient. They're most likely going to have significant gut issues and heavy metal issues. Every person is unique. So those two things are causing significant inflammation at the blood vessel level, not necessarily in the joints. Another person may have the same thing but have joint pain and autoimmunity, not heart disease. So this patient with their genetics has heavy metals and gut issues causing inflammation, which is causing symptoms. Now, I'll take it a step further. I'm a believer, and this is an opinion part, I'm a believer that almost all disease is autoimmunity when boiled down. The immune system has gone awry and attacked itself, and that's why you're having disease. So I've said for years that atherosclerosis is actually an autoimmune destruction of the blood vessels. Why do you have plaque in your arteries? Why is your immune system attacking your arteries? If you've asked yourself that question, and you've asked other doctors, you've probably not gotten a straight answer. Why is the body attacking and inflaming its own arteries? The answer is, in my mind, autoimmunity. Now, I used to say that was opinionated and biased, but in March of 2023, there was a research article that vindicated me and said that it is autoimmunity. Now, this is one study, and there might have been others since then, but I know of that one. And so hopefully I will be vindicated by more studies showing that autoimmunity is the cause of heart disease, not cholesterol, as I've been preaching and many other of my colleagues have been preaching, that cholesterol is not the reason for heart disease. So I could go into this diagram multiple times, but the idea is whoever you're seeing, whatever doctor you're seeing, whatever practitioner you're seeing, if they're giving you a supplement, if they're giving you a medication, understand where it belongs in this diagram. And once you understand where it belongs in this diagram, then you can understand how they're treating you. Are they just temporarily covering a problem? Let me clean up my diagram. Are they just using drugs for a symptom? Oh, didn't clean up the diagram. Try that again. Are they just using drugs to clean up a symptom? Are you on we'll use the reflux idea again. Are you on a Prilosec type drug for a symptom that you're just stuck on? But you weren't born with a reflux issue. You weren't born with needing Prilosec. You developed it later on. Why did you develop that issue? Well, maybe your provider has you, and is a functional medicine provider, and has you on a gut supplement to help with that reflux. Are you still on that gut supplement? Is it covering the symptom? Why haven't you fixed the problem? Why did you develop reflux? If you're stuck on a supplement and can't get off of it, it generally means there's a root cause that's still feeding that problem. So for example, maybe they're treating the stomach inflammation that's causing the reflux, and you're stuck on this supplement, can't get off it. It's probably because there's a gut issue up above in fungal overgrowth or bacterial overgrowth that's causing the stomach inflammation. And yes, the supplement's cooling the inflammation, but not fixing the root cause. So I apologize if I have disparaged you or your practitioner, but I've held off on this video long enough because I'm scared to disparage others. I'm kind of scared to give out our intellectual secrets. This has been something that I've sat on for a long time, several years, and not posted out on social media because it is one of our secret sauces, our belief patterns. But I think it's time that we share this with the world. And if anyone else can use this and patients can use this to take it to their providers and help understand where they're at, if providers can learn from us and get better at what they're doing, then great. We would love to start a process of training other providers one day. So if you're interested in learning from us, please reach out to us and see what we can do to create a business out of teaching other providers so that they can learn and learn faster than it took me to learn this stuff. So I hope this root causes diagram was useful to you. Once again, the next video in this series of root causes will be the treatment timeline, and that is how we treat these root causes. What's the A to treat, then the B. If you go A to Z to D to G, your body's not going to make sense of it. What's the lowest hanging fruit? The idea of that metaphor makes sense. If you're going to eat the fruit of a tree, or going to climb to the top to grab the first fruit to eat, no, you're going to eat the fruit on the ground that's easy to grab to energize your body, so that then you can reach up and grab the low hanging fruit. Then you're going to climb the tree and get the higher fruit. But the idea is you got to get the low hanging fruit first. If you fix the gut starts fixing everything else for you. So why are you detoxing before you fix the gut? Why are you trying to kill Lyme before you've restored the immune system? Always start with the gut. A lot of practitioners pay homage to treating the gut, and all they do is give you a probiotic and you walk out of the office. That's not enough. You have to treat the gut adequately. We commonly treat guts for 6 and 9 months, sometimes years, to fix people's broken guts over time. So anyway, that's enough. And hopefully this root causes diagram helped you or will help someone else. Please spread it around. Bye, guys.